I'm Arushi from the IPPF South Asia Regional Office. We'd like you to take a look at the status of integration of HIV services with those of sexual and reproductive health. We've taken India as a case study. Let's now move to a hospital in northern India and gauge for ourselves what is happening on the ground. आपको मालूम है इस अस्पताल में HIV का टेस्ट किधर होता है?
जी नहीं। जी नहीं।
आपको मालूम है माँ से बच्चे तक HIV रोकने के लिए ट्रीटमेंट कहाँ मिलता है इस अस्पताल में?
नहीं, इस बारे में कोई जानकारी नहीं मुझे।
Dr. Talwar, I'd like to know from you how many ANC clients you see in a month and whether they are given information on HIV, especially mother-to-child transmission.
We see about 20 to 30 ANC patients a month, and yes, they are all given information about HIV, and if after counseling they are willing to undertake the test, the blood test, then they are referred to the hematology department to undertake that blood test.
आप जो जानकारी लेने आए थे वो आपको मिल गई?
हाँ जी।
आपको गर्भनिरोध के बारे में कुछ बताया गया?
जी नहीं।
आप जो जानकारी लेने आए थे आपको मिल गई है?
नहीं, यहाँ पे तो सिर्फ STI की जानकारी दी जाती है। HIV की तपासने के लिए मुझे और भेजा जा रहा है।
I'm here with Dr. Bharija, skin and VD specialist, and I want to know from him whether he gets any referrals from antenatal care or the gynae department, as well as what he does with HIV positive patients. Over to you, doctor.
Yes, we do get referrals from the gynae department whenever the patient has an unprotected exposure outside, and he has that fear in him that he has probably acquired the infection. The first thing he does is he comes to us and he's asking about that he got HIV. Then we refer the patient to the relevant internist doctors who are treating the HIV patients in our hospital.
आप जो सुविधाएं लेने आए थे वो आपको मिल गई?
जी, सुविधा तो मिल गई, लेकिन सुबह से हम लोग दूसरे डिपार्टमेंट में खड़े थे, वहाँ से अभी यहाँ पर भेजा है। यहाँ पर भी इतनी लाइन है कि पूछो मत, हम लोग इतने परेशान हो गए, अभी यहाँ से वापस वहाँ पे भेज रहे हैं। तो सभी सुविधा एक ही जगह पे होती तो बहुत अच्छा रहता था।
You all know how difficult it is to access the services related to sexual and reproductive health needs, family planning needs, and HIV related needs for both men and women, especially for women who are in need of these services. If they have to access these services at various settings and under various buildings and run by various programs, it's much more harder for them to access and realize their sexual and reproductive health needs. So it is must that we need to integrate the sexual and reproductive health services with HIV related services or vice versa, because by ensuring these services integrated, we make sure that people living with HIV and people who are negative, who are in need of these services, access these services in a user-friendly manner.
Integrating HIV services with sexual and reproductive services is relevant to a country where the sexual route is the predominant route of transmission. What about a country where injecting drug use is the predominant route of transmission?
Look, IDUs are men, women and transgenders, and injecting drug behavior is not 24/7. They do have sex, they do have family planning needs, and they do have reproductive and sexual health needs. And it's the right time and high time to integrate these services regardless of who we are targeting, whether they are IDUs, whether they are sex workers, whether they are MSMs, whether they are HIV positive people.
Let's now get an expert's opinion on the importance and quality of counseling being imparted.
When we look at the various counselors across the country, particularly in the VCTCs, you realize that the 1-week training that they've had is not really enough. What they require is a lot more training, because when dealing with the various risk factors which are associated with HIV, they are dealing essentially with information which is either socially unacceptable and stigmatizing, or even sometimes on the fringes of the law, for example with drug abusers. Training needs to be much more focused, prolonged, and allowing skill to develop rather than just some information given over a week. Now, what is the solution? I don't know. There are many possibilities. One of them could be that we could take people who are already involved in similar areas, for example, psychiatry, sexual and reproductive health counselors or STD clinic counselors or youth counselors, integrate them into this, widen their knowledge and improve it to make it more comprehensive.
When it comes to counseling, it's not just about safer sex and unwanted pregnancies. What about the men who come with the pregnant women? Does the health facility engage with these men and provide them information on sexually transmitted infections, HIV and contraceptives without their having to ask for it?
You know, we know that we have to engage these men, especially in the sector of men having sex with men. Now, if you look at the statistics in this sector, what's interesting is that 9 out of 10 such men know that condoms can prevent STIs and HIV, know where to get them, and yet hardly 4 out of 10 use condoms. So, considering the fact that a majority of these men are married to women, you can imagine what a huge bridge population this is. What that means is that you have to get to these men, you have to intervene in this sector, and you have to be able to get them to use condoms.
IPPF initiated one such intervention with FPA India as a small experiment. A clinic in Bombay catering only to women's sexual and reproductive health needs began HIV-related services for men, especially men who have sex with men. Let's hear from the service providers and clients how they feel about it.
When IPPF selected our clinic to be an MSM-friendly clinic, we accepted as a challenge. But now we are very happy with the services and with the result, where we are providing infertility and family planning treatment. At the same place, now we are providing STI treatment and HIV counseling for men and women.
जब मैं पहली बार अपनी वाइफ के साथ FPA के क्लिनिक में आया तो सिर्फ उसकी काउंसलिंग के लिए आया था, मगर जब काउंसलर ने मुझसे भी बातें की और मेरी परेशानियों के बारे में भी पूछा तो मुझे ऐसा लगा कि मुझे यानी कि एक MSM को भी यहाँ पे फैसिलिटीज़ और काउंसलिंग मिल सकती है, और जो कि उन्होंने की। जब उन्होंने मुझसे भी बातें की और मेरी परेशानी के बारे में पूछा तो मुझे भी काफ़ी फ़ायदा हुआ और काफ़ी समस्याओं का समाधान हुआ। और अब तो ऐसा है कि एक ही रूफ के नीचे मुझे और मेरी वाइफ दोनों को काउंसलिंग, क्लिनिकल हेल्प सब कुछ मिलता है, जिससे कि हम बहुत खुश हैं।
As we have seen, the integration of HIV services with those of sexual and reproductive health require greater attention from the policymakers of today. How is this snapshot of the status of integration in India relevant to the entire region? A final word on this from the South Asia Regional Director of IPPF, Ms. MADHU NATH.
The issue of HIV and AIDS and the integration of services applies not just to India, but across the world, across the region. The problem is that we have set up these national AIDS programs that are functioning like small oases in huge deserts. They have very limited spheres of influence, which is fine as long as it is all about awareness creation. But the moment the epidemic progresses and we need to deliver services, there are really no clinics with these departments that can reach people's backyards. As a result, what is happening is that people are not being able to get treatment, care and support. And these programs are not being able to move in the direction that they were set to. Integration, therefore, is absolutely urgent, and because HIV and AIDS is a sexually transmitted disease, it is but automatic that we start integrating these programs with sexual and reproductive health services and their clinics.